Hi, this is Dr. Andrew Yun and Marilena Kutami. Okay, so this is our overall slide deck, whether it's live or Zoom or in this format. So this will not be interactive. So I'm just going to be the one talking. Marilena and I will just be the one that is talking. But if you want to be in a more interactive format, go ahead and do the online class with Tracy or Lisa. So there is a lot to cover in this talk, but we're going to break it down. There are 8 topics here. We're just going to go over the first couple of topics, and in later videos, we'll bring in the preparation, day of surgery, after surgery. So this is going to be about information, anatomy, and education. So let's get started. Information is mostly housekeeping. We'll tell you about the current COVID situation. We're going to tell you about why surgery could be postponed or canceled, and how we will prepare you, how we will communicate with you before surgery. So let's start with COVID. So as we go through this, there's a lot of very important text. Feel free to pause and read the text. Okay, but I'm just going to highlight certain things for you. So this is now summer of 2022. Things are so much better than they were a year or 2 years ago. But I want you to know safety is still our top priority. We've done over 2,000 surgeries since April 2020 when COVID first shut us down without any patient transmissions. And so I'm just going to take you to our brief protocol. So this protocol is based on preoperative testing and patients being asymptomatic. So if you are to have surgery with us, and every program around the country will differ, but at St. John's, all patients will be required to show evidence of a negative PCR COVID test done at the hospital at our outpatient center. So a home antigen test does not suffice. Going to your other doctor does not suffice. It has to be a negative PCR COVID test done at our hospital. And it has to be done no more than 3 days from the date of your surgery. Okay. We have our own PCR machines. We get the turnaround very quickly in less than 24 hours, and we'll let you know. And then we ask you to be responsible because we want these results to be legitimate. So please, after your test, be careful, stay home, mask up, just so that you don't alter the results of your negative test. And also, the hospital has policies. The state has policies about visitors who are able to visit. So please review those policies. Those policies change constantly depending on the rates of transmission in the community. So they vary constantly. Just check with them. Now, these are the most common reasons that surgery can be canceled at the last moment or postponed at the last minute. A positive COVID test, cold, sickness, fever, just feeling sick, or nausea, vomiting, diarrhea, or emergent dental issues. There are rare, but if anything does happen, it's typically in this basket of issues. I'll just go back to positive COVID tests. So we get a PCR test on everybody, but many times a patient is very surprised to find out they're COVID positive. And that's because these PCR tests are so sensitive. So many patients who show no symptoms, even with the positive COVID-19 test, can safely have a surgery 11 to 12 days after this test. All these other ones, you just got to wait till you feel better before you have surgery. Let's also go over our methods of communication. So it's very important that we have a robust system of communication, and we're going to use phone calls, and we're also going to use this text messaging platform called Twistle. Twistle is a service that you will be automatically signed up for once you book your date of surgery. You can always opt out, but you will automatically put into it once you are given a surgery date. And within Twistle, you will receive a series of preoperative and postoperative messages that are the most important reminders of what needs to be done at that moment. A week before, 2 days before, a day before surgery. So these are very helpful. Some of the messages will also have additional links that you can click onto to fill out health surveys. And our goal for all of this is just to keep you on track, and these are very gentle reminders to make sure that you're not forgetting anything crucial in this process. If you have more important things, please let us know by MyChart. Twistle is just a one-way platform. Do not reply to anything you get on Twistle. It will go nowhere. Twistle is just for us to send you information. If you have questions, you reach out to our office via My Chart on Epic or by phone. You will receive 4 phone calls. Please pick up your phone when you receive these. The first one is going to be from our pre-registration. That's just the hospital's business office. This department is just going to call to verify demographics, insurance billing. I know you've already done this before, but they still got to do it again to make sure that everything is as accurate as possible. No call during business hours. Please pick up your phone for pre-registration. These guys are legit when they're asking for your demographics and insurance information. The second call will be a medical call. This will be from our preoperative nurses. They will call you the day before surgery to review your health history, your medications, your allergies, to give you instructions for the next day and to answer any questions you have. So we have your health history. We've gone over everything, but we need to go over them with you to clarify your record and to see if you have any further questions. So this is a very important phone call. If you do not receive this phone call the day before your surgery, please give us a call, but expect to receive this phone call. The third phone call, so the first is pre-registration, the second is nursing. The third phone call is from our surgical office. And our office will call you the business day prior to your surgery date. So if you're having surgery on Wednesday, we're going to call you Tuesday. We're not going to call you 48 hours or a week. We're going to call you the day before. Now, if you're having surgery Monday, we're going to call you on Friday, typically around noon, between 11 to 1:30, to let you know when you should come in, when you should check in on your surgical day. Please pick up that phone. The fourth call before surgery comes from the anesthesiologist, and every patient has questions about anesthesia. This anesthesia call will be an opportunity for the anesthesiologist to review your health record and for you to ask questions and bring up any concerns you have with the anesthesiologist. This happens the evening before surgery. The anesthesiologist will have had a chance to review your entire medical history, and the surgeon and the anesthesiologist will have had a time to discuss any concerns. They will then contact you to see if you have any concerns and then offer their opinion on the safest way to proceed with the anesthesia. If you have any questions before this, feel free to call them. They're called Bayside Anesthesia Group. For regular questions about your anesthesia, if you have any concerns, call this number. If you have specific billing questions, call this number. We have 2 more slides to cover. This is going to be a brief discussion of anatomy in the knee and in the hip. Okay, so let's just go over the basics of native or organic knee anatomy and then a total knee anatomy. And so in a normal knee, we can see all the different elements coming together. There's bone, there's soft tissue, there's ligaments, and there's cartilage. So in an arthritic knee, for the most part, all these other elements are healthy, but there is a breakdown of this surface, which is the cartilage. And so when we correct this problem, all these other elements remain. We are going to just correct the deficient cartilage. We will replace that with a combination of metal and polyethylene so that load can be transferred from the femur and the tibia. If we look over here, we can see we've maintained bone. There's muscle, ligaments, soft tissue all around that. But where this cartilage, this arthritic cartilage formerly was, we now have a metal cap and we have a new cushion to replace the fibrocartilage that is now gone. Now in this total knee replacement, we can now see there can be an appropriate transfer of load between these materials, between femur and tibia. Hip replacement is very similar in concept. It's a slightly different joint. Instead of a hinge, it's a ball and socket. So around the hip, we have the acetabulum, which is enclosed within the pelvis, and then we have the femur. The hip joint primarily is composed of the femoral head and the socket. And in an arthritic hip, we see a breakdown of the cartilage at the femoral head, this purple material, and a breakdown of cartilage in the socket. So when we replace your hip, we're replacing these 2 areas. We do that using these components. We do that by removing this damaged ball at this area so that we can insert this stem into the bone. The purpose of this stem is to hold the neck, and the purpose of the neck is to hold this ball. This ball now reproduces this ball that was removed. On the acetabular side, we need to recreate a socket with cushion. So we will put this titanium cup into the pelvis, and then we will put this polyethylene liner. This polyethylene liner acts as the substitute for the missing cartilage. So again, we have four parts. We have a stem, we have a ball. This replaces this side. And on the pelvic side, we have a cup and we have a liner. That replaces this side. And now with the hip replacement, we can transfer load properly between the pelvis and the leg. Thank you for attending this virtual education class. Again, we do have the live back and forth question and answer session run by Tracy. Tracy is our nurse educator. She does a fantastic job. Feel free to watch this again, or feel free to attend that section if you're having surgery at St. John's. And then look out for part 2 coming shortly.